nervous, tense, worried, afraid. It is quite normal. Feeling such discomfort does not necessarily mean you suffer from an anxiety disorder, as normal feelings of apprehension are not the same as anxiety.
Hello beautiful people, in this session we are going to discuss about different aspects of anxiety and how to get out of it. Watch and listen till the end so that you don't miss a single issue that can help you out. Right you are. So let's start. Chapter 1. The most asked question was, how common is anxiety? One of the major features of an anxiety disorder is the feeling of a non-specific discomfort that can occur without a real reason. The World Health Organization projects that anxiety disorders will become the second most common cause of disability worldwide by 2020. Around 275 million people suffered from anxiety disorders in 2016 globally. NoPanic.org states that 7.8% of the British population suffer from some form of anxiety or depression. That's roughly 1 in every 13 people in the UK. Females are twice as likely to experience generalized anxiety disorder than males. Second chapter. Different types of anxiety disorders. Anxiety refers to a spectrum of mental health disorders. The most common forms of anxiety include generalized anxiety disorder, social anxiety disorder, panic disorder, phobias, obsessive-compulsive disorder and post-traumatic stress disorder. Now let me enlighten you about the overview of these symptoms of anxiety. Anxiety symptoms may be severe to the extent where they affect our emotions, thinking, and ability to perform day-to-day tasks. Also, anxiety can manifest through physical symptoms. If your emotional, cognitive and behavioral reactions are out of proportion with what is normally expected in a given situation, chances are you may be experiencing anxiety. Some of the most common emotional and cognitive symptoms of anxiety include extreme worry and fear, feeling agitated and irritated, fatigue, a generalized fear of pending trouble, feeling a loss of control, attention and focus difficulties, or a tendency to avoid situations or people that trigger anxiety. At the same time, you may be experiencing a variety of physical symptoms. Some of the most common physical symptoms of anxiety are dizziness, nausea, sleep problems, headaches, chest pain, stomach aches, legs and arms numbness, increased heart rate, feeling constantly worn out, shortness of breath and sweating. Chapter 3. Anxiety causes and risk factors. Research shows that many different factors or a combination of these can cause anxiety. Factors that may trigger anxiety include genetics, environmental factors, brain changes, other medical conditions and a person's own thinking patterns. Genetics. In a way, anxiety runs in the family. This mental health condition is more common in people whose blood relatives also have anxiety. Environmental factors play a vital role, as studies show that ongoing day-to-day stress can significantly contribute to anxiety disorders. Other serious underlying medical conditions can cause anxiety disorder. Brain changes affects too. Research shows that in some cases anxiety may result from changes in the brain structure and function, as well as from disturbances of hormones that occur as a reaction to stressful or traumatic life events. Distorted thinking patterns, the internal factor of anxiety disorder. The above were all external factors on anxiety, but anxiety symptoms often also develop internally as a result of a person's insecurity, low self-esteem, self-criticism and negative thinking patterns.
9, 10.
The final chapter is about anxiety treatment. While it is not a life-threatening condition, anxiety can be very unpleasant and it can severely interfere with our everyday life. However, anxiety disorders are also highly treatable. The most effective treatments for anxiety are cognitive behavioral therapy, exposure therapy, and eye movement desensitization and reprocessing. Cognitive behavioral therapy. There is much scientific evidence that proves the effectiveness of cognitive behavioral therapy in treating anxiety. CBT is a short-term and goal-oriented therapy with a focus on specific problems. It has proven to be successful in helping people with anxiety by changing their dysfunctional thought patterns and behaviors. Exposure therapy. This form of therapy is effective for obsessive-compulsive disorder and phobias. During therapeutic sessions, a person is gradually exposed to a situation or object that triggers fear. By the end of the treatment, the person learns to become less sensitive to a feared object or situation. Eye movement desensitization and reprocessing. EMDR is an approach based on cognitive behavioral therapy. It was originally developed as a treatment for post-traumatic stress disorder. However, EMDR has lately been used to treat a wide spectrum of mental health issues such as generalized anxiety disorder, phobias, panic attacks, and other mental health conditions. Self-help strategies and lifestyle changes. The first step in overcoming anxiety is understanding what you are dealing with. To effectively manage anxiety, you need to understand what is causing it. Learn to recognize the circumstances or people that usually cause feelings of discomfort. Set clear personal boundaries, learn to assertively express your needs and feelings, and make positive shifts in your lifestyle. Practice mindfulness meditation and relaxation techniques such as deep breathing. Studies show that mindfulness can ease anxiety symptoms, boost your optimism, and improve your self-esteem. Also, relaxation techniques like deep breathing or tightening and relaxing your body muscles can help you feel relaxed and composed. There is also research to show that social media can affect your mental health and increase feelings of anxiety. Try to limit your time on social media. End note. Try to limit your time on apps like Instagram, Facebook, Snapchat, and so on. In our next session, we will discuss about the effects of social media and how much it can affect your mental health and increase feelings of anxiety. Till then, stay safe. Signing off. Oh ho. I forgot to remind you all that please take care of yourself and maintain social distance to keep the COVID-19 curve down. Remember, survival is nothing but a choice nowadays.